transmission rate, so that was wrong. That myocarditis is more common after COVID infection than it is from the vaccine. Not true. JAMA Cardiology showed that it was 4 to 28 times more common after the vaccine in a particular cohort. That the lab leak was a conspiracy theory. Both Dr. Farzan and Gary, the nation's two top virologists, told Dr. Fauci in January of 2020 in an emergency meeting that Fauci called that they thought it was the lab leak, and yet it was billed as a conspiracy. And finally, that the bivalent vaccine and the boosters are effective and necessary for young people. We've had no randomized controlled trials. Dr. Jha at the White House said it's crystal clear. To me, it's crystal clear a young, healthy person should not get it. No one on the congressional committee or at the CDC has ever been able to tell us if any healthy American child has died of COVID. It may have been a couple, could have been 3, 5, 10 over 3 years. That's way below any respiratory pathogen. How can you push something so aggressive with such absolutism and dogma without the data? We don't even know if any healthy child has ever died of COVID. Now, public health officials and the CDC are proposing that a 12-year-old healthy girl get 60 mRNA COVID vaccines in her average lifetime, 1 a year. This is where we've got to demand data before following these recommendations.
That's what they're demanding right now? It's hard even to believe that, given everything we know. That seems deranged and scary.
Annual vaccinations for all people. That's the mantra right now, and it's all or nothing.
Last question, Doctor, is there an organized, I mean, that's so unwise. You've got to think there's an organized resistance to that. Do you think that could actually happen? It could become compulsory?
Yeah, most of the resistance are practicing physicians, but because anyone who disagrees with the mantra is dismissed or censored or deleted or excluded from national meetings, it appears as if there is a unified consensus of physicians. The CDC's own study found that 40% of pediatricians do not recommend the COVID vaccines for children. That should say a lot. And when I go to the doctor's meetings, none of them have been wearing masks over the entire last year. That should say a lot.
Yeah, it does say a lot. Dr. Marty Makary, a brave and learned man, thank you so much.